Hello, fellow advanced practice registered nursing students. I would like to talk to you a little bit today about the certified nurse midwife. Midwife is a common term used around the world, but the definitions and preparations vary in countries around the world. The definition of the certified nurse midwife in the United States is as follows: an individual who is knowledgeable, skilled, and professional independent midwifery practitioner, and who has met the standards of certification set by the North American Registry of Midwives.
The history of the midwife is in the old days, prior to the development of a midwife program or college, developed program training was hands-on experience with previous midwives. Generations passed down knowledge to each other, and there was no databases or collection of evidence or tracking tools for research. It was all word of mouth by individuals. The introduction of midwifery in the United States was when Mary Breckinridge utilized the British model, which combined nursing and midwife practice. This model was utilized in practice and first introduced in rural counties of Kentucky. This midwifery practice and model has opened doors and paved the way for advanced practice registered nurses. Over several years, criteria for accreditation, educational programs, and national certifying examination was developed. Prior to 2010, midwives had to have a bachelor's degree in nursing with specialized training in midwifery practice and pass a national exam. Today, midwifery must have a master's in nursing, complete clinical hours, and pass a national exam. Nurse midwifery activities were key in securing prescriptive authority and reimbursement of insurers. Today, midwifery continues to be active politically and clinically to develop and gain respect and acceptance of practice in communities.
There are a few requirements to become a certified nurse midwife, which include obtaining a master's or doctorate degree from an accredited school of midwifery, which there are 40 graduate programs in the United States at this time. A doctorate's not required, although it is recommended by the AACN. Recertification should happen every 5 years, and you must either complete 3 modules and 2 approved continuing education units from the AMCB, or take the certification exam that you took to become a certified nurse midwife in the beginning. Midwives can work in a variety of settings across the United States, and certified nurse midwives are regulated on a state-by-state basis, and there are also numerous regulatory and reimbursement barriers at the local, state, and federal levels. Hospitals have their own credentialing standards as well. So you may want to work at a hospital, but in the state you live in, you may not be allowed to work in a hospital as a certified nurse midwife, and sometimes you aren't. I know in 2 states you're not allowed to practice home births. So you must research before you become a certified nurse midwife on the areas you can practice in the state you work. The scope of practice for the certified nurse midwife varies a lot from state to state, person to person, whether the practitioner wants to practice in the independent field of primary care and provide just gynecological and family planning services, or whether that person wants to just provide childbirth. But there are also full scope of care certified nurse midwives that practice all of the services listed on this screen. These certified nurse midwives can conduct physical exams. They can prescribe medications. Sometimes prescribing medications is based off of a doctor looking over their prescriptions, depending on the state they're working. They can admit, manage, and discharge patients. They can interpret labs and diagnostic tests. They can order the use of medical devices for patients. So it really just depends on the state you work and the hospital you work, what you're allowed to do as a certified nurse midwife. Each of the 6 core competencies for nurse midwifery are very similar to those listed in the Advanced Practice Registered Nurse model and follow the same principles as a direct care provider. So nurse midwives have 8 standards of practice, and I'm going to go through each of one of those, and each standard of practice has areas of the 6 core competencies listed. For standard of practice 1, midwifery care is provided by qualified practitioners. So these qualified practitioners are those who graduate and pass a national certification exam and have successfully demonstrated the ACNM's core competencies. The certified nurse midwives are required to recertify and maintain continuing education every 5 years in order to continue to practice. State regulations vary across the United States, which can limit abilities of the certified nurse midwife. Standard of practice 2 is the midwifery care occurs in a safe environment within the context of a family, community, and health system. A practicing certified nurse midwife or certified midwife must know and understand their state regulations in which they are licensed and provide care. The certified midwives are legal to practice in 10 states in the United States, and 12 states have no laws or regulations, and 2 states prohibit certified nurse midwives from performing home births. There are 3 barriers of regulations facing the certified nurse midwife, certified midwife level of practice, which includes requirements of physician supervision or written collaborative agreement requirement of the physician supervision of prescriptive authority and home birth legislation laws, as indicated by Walker, Landon, and Rossi in 2014. The standard of practice 3 is midwifery care supports individual rights and self-determination within the boundaries of safety. The philosophy and code of ethics according to the International Confederation of Midwives includes several factors, including midwives develop relationships, the practice of midwifery, professional responsibilities of midwifery, and the advancement of midwifery knowledge and practice. This code of ethics outlines and includes information that leads to informed decision-making, obtaining consents for the evolving care with an acceptance of responsibility for the outcomes based on their choices. Midwives empower women and families to individualize planning based on their culture and society. Midwives support and respect each other and nurture relationships while preserving integrity. Certified nurse midwives must follow their scope of practice according to regional legislation in the state they are licensed. Care must encompass non-discriminative care addressing psychological, physical, emotional, and spiritual needs of women. Nurse midwives must continually seek out personal, professional, and intellectual growth throughout their career. The standard of practice 4 is midwifery care is composed of knowledge, skills, and judgments that foster the delivery of safe, satisfying, and culturally competent care. The certified nurse midwife must complete a master's degree in practice and pass a national certification test showing that they have the skills, knowledge, and understanding of practice for the care of mother, infant, and family. These skills include understanding and practicing cultural competence of care. Patient and family care must be individualized based on their requests and build support around their respective beliefs. The standard of practice 5 is midwifery care is based on knowledge, skills, and judgments reflected in written practice guidelines that are used to guide the scope of midwifery care and services provided to patients. Practicing midwives must encompass the family as a whole and be able to maintain skills to assess, diagnose, and treat these individuals. When they are unable to provide further care to a patient or beyond their scope of practice, the certified nurse midwife must be able to demonstrate the ability to transfer a patient to another facility for further care or to another medical professional for further care. The standard of practice 6 is midwifery care is documented in a format that is accessible and complete. Nurses at any level must learn early on that if it is not documented, it didn't happen. Nurse documentation is a necessary component of safe, ethical, and effective treatment. The same practice and standards apply to certified nurse midwives as they maintain records and documentation of care of patients. This information must be secure and confidential. Today, healthcare organizations utilize electronic health records, keeping of events driven by federal acts of incentivizing hospitals and providers in order to receive reimbursements for health care of Medicare and Medicaid patients. The standard of practice 7 is midwifery is evaluated according to an established program for quality management that includes a plan to identify and resolve problems. Midwives must practice and care for patients in a variety of settings, including hospitals, homes, clinics, and must be able to provide quality care based on patient requests and the needs of or state regulations. The standard of practice 8 is midwifery practice may be expanded beyond the ACNM's core competencies to incorporate new procedures that improve care for women and their families. The ACNM has a long-standing reputation of staying politically motivated to remove state law barriers that limit their practice. Staying active and involved as a practicing certified nurse midwife may reduce or remove some of these barriers to practice. Many states require a certified nurse midwife to obtain privileges to practice safely and consult with hospitals and physicians. There are many different challenges faced by the certified nurse midwife, and one of the big areas of challenge is image. Because image in the United States for the certified nurse midwife varies among communities and healthcare settings. Many different practitioners call themselves midwives, but there's no single standard, which can lead to confusion in the role. Many people believe midwives lack a formal education, but there is evidence of change occurring in the mindsets of many people. There's evidence of increasing visibility for the certified nurse midwife and influence. Another big area of challenge is professional liability. Midwives need to clarify all parts of their professional liability insurance, and nurse midwife liability insurance rates are generally higher than those of other advanced practice registered nurses because of risk of malpractice in maternity care. Work life for advanced practice for certified nurse midwives are usually long hours, around 35 a week on average, with 11 on-call hours on average. Long hours relate to increased fatigue and risk of work mistakes. The ACNM published a document with recommendations for sleep and safety of midwives and midwifery students. There's a pretty positive future outlook for certified nurse midwives in the United States. They're predicted to grow by 9% by the year 2020 and be able to practice in all 50 states. They're also looking at getting competitive wages when compared to other advanced practice registered nurses. There are not too many potential role changes for the certified nurse midwives, only the doctorate degree instead of a master's degree, and there's no really other significant changes to the role at this time. In conclusion, there are many positive advancements that are evident for the certified nurse midwife at this time. The ACNM has been extending its reach and collaborating broadly with many different other groups. The need for midwives has been recognized not only around the world but in the United States. And the United States has an increased consumer demand, an improved public image, a growing certified nurse midwife research evidence base, and a strong national quality and educational standards for the nurse midwife. Here are the references that we have, including all images. Thank you for listening to our lecture today and learning a little bit more about the certified nurse midwife's role in the United States.